Hey everybody, it's Steve. Hey, thanks for joining me today. Hey, this is the 3-week update video of my rotator cuff surgery, and actually it was a bicep tendon surgery as well. So I'd like to do a check-in. I did a 1 week. If you haven't seen that, I'll put a link down below. I did a 1 week check-in and I did a 2-day post-surgical check-in, and this is the 3-week check-in. So since my last video, I have gone in and saw the doctor, visited the doctor on my 2-week follow-up. We went through, they removed the stitches, kind of looked at things, gave me the overview, wrote the order for physical therapy, and gave me instructions for 2 more weeks of in the sling. I knew that going in. He was saying it was going to be 4 weeks immobilized in the sling before I could do anything with it. And then I've got 1 more week after this with that, and then physical therapy starts. So that said, that's kind of where we're at in the process. I see him again in 2 more weeks after that. So I'll see him at basically the 2-week mark and then the 6-week mark. And I'm not sure if I have another visit after that. I would assume, but I don't know. So either way, so that's kind of where we're at as far as meeting with the surgeon. He did explain what was done. It was what he said going in. There were no real surprises per se in the surgical procedure itself. So what I ended up having done, I know everybody's surgery is different, but just as a recap of what mine is, I had a right shoulder arthroscopy and an arthroscopic bicep tenotomy. Tenotomy. I don't know how to pronounce all these words. A labral and rotator cuff debridement. Arthroscopic subacromial decompression by acromioplasty, and a right shoulder mini open biceps tenodesis. So from what I understand, that last one there, what he did was that the biceps tendon that comes across and comes up over, I guess over the rotator cuff or whatever, was causing some of my problems as well, as far as pressure and tightness and whatnot. He ended up cutting that somewhere, and it feels like it's on the outside because it's sore now, but he cut that and then he reattached it, the biceps tendon on the inside, using some type of button, some type of surgical button. So that's kind of basically why I think I'm immobilized for 4 weeks. I know some people, it's only 2 weeks and they start physical therapy and things like that. So I wonder if that's the reasoning behind my schedule that I have, and also being totally immobilized for 4 weeks. So that said, I do have my physical therapy starting here after Labor Day, and it's going to be, I think it's going to be 3 times a week for 4 weeks, or potentially 2 times a week for 6 weeks, depending on the evaluation and progress and whatnot. So that's kind of where we're at with the surgery. Pain and discomfort and all that wise, things were pretty good once I got through that first week. That first week and maybe a little bit into the second week, the pain settled down. There's a couple nights there that the pain it came in full bore. I had to use the heavy medicines to keep it contained. It was nighttime and it was bad. It was probably a conservative 7.5 out of 10 on the pain scale. And I tried to get ahead of it, and I did a pretty decent job, got through the night. But once that settled down, it was pretty much pain-free from there for a while. Now, within the last week, I guess I could do limited things as far as typing on my keyboard here at home and things like that. I have not gone back to work yet. I'll do that after the holiday. But I did a little bit of, he said I could do some light typing, things like that. So I did some of that, and it's not the typing that hurts, but it's just the general movement of the arm because it's been immobilized for so long. And I feel more of the achy on the outside now, whereas before a lot of that pain was on the inside and then the inside of the elbow from the muscle being tight. I have been doing the exercises to stretch out the elbow and the hand and the wrist and some of that, but I'm supposed to keep this pretty much no pushing, pulling weight, anything like that. So that's where that's at. So all in all, I took a leave once in the last week, maybe a week and a half, which is pretty good. I'm pretty happy with that. That was just a couple days ago because the pain in here was starting to throb up. So a couple things looking back now that I wish I knew going into the surgery, questions I wish I would have asked going in, and a couple things I wish I would have done around the house to prepare better. I know I mentioned some of those in the last video, but a couple extra things I've kind of picked up over the last week and a half, 2 weeks. See, first off, practicing. I wish I would have practiced my balance with one arm better. Getting up out of bed, stepping over the tub wall, getting in and out of the shower, things like that. Getting up and off of a toilet without having to push off on this arm at all. Getting in and out of bed, getting in and out of the recliner, things like that. just getting balance tuned up, especially at nighttime. You get out of bed and get out of the chair and you're kind of groggy, and it's the last thing you want to do is fall. And it's something that's really on your mind too, as the balance as well. So working on balance would be one key thing. Getting used to working one-handed. I mentioned in the last video things like taking the cap off the toothpaste and the shampoo bottle that has the snap top, things like that, things that you can do that make it easy to function with one hand. Pill bottles, you can't open pill bottles, especially the child safety ones are a real challenge. So I have my daily pill thing I can open with one hand and take my medicines and things like that, my vitamins. Let's see. Some additional things also, and actually I want to thank my sister. She had sent me a packet of them, but the toothpicks, these are something I've never used before. These are those, I don't know what you call them, little floss pick things. They got dental floss on one end and a little toothpick on the other end. These have been really, really, really helpful because normally I would floss with two hands and I can't do that. So this has been very, very helpful. I want to thank her for that. So I keep a set of these down on my chair, where I sit during the day, and I also have some up in the bathroom, but very helpful. Some additional things also, clothing. Find the biggest oversized t-shirt that you have, because the first few days when you get dressed, you're not going to want to be moving at all. Like now I could wear a little bit snugger shirt. It's a little bit easier to work around, but in the early days, you want as loose and baggy as you can get. So I didn't do anything special, just used a regular oversized t-shirt that was well worn and easy to work with. So I had that. A couple other things, just items of note, is other things to prepare for. Like I mentioned, I got my hair cut, and I'm glad I did that. Trimming nails would be another one, because here I'm 3 weeks in, I can probably trim nails on one hand, but not the other, things like that. Let's see, shower scrubby, using a shower scrubby instead of a rag or whatever. It makes it a lot easier, especially once the stitches are healed and things like that, and you need to get up underneath the arm and things like that. The big squishy scrubby lathered up with soap makes it real easy, low impact way to clean. Let's see, have your slings ready. I have the two. I had the one that they gave me, and if you have an opportunity in a pre-op conversation with the doctor to find out what type of sling they're going to get you, I would ask to see that, so you know if it's going to do what you want it to do, or if you want to get something else ahead of time so you don't have to wait a couple days for it to show up in the mail or whatever for the delivery. I ended up going with one I got on Amazon, which goes over the shoulder and the arm slides into it, and then it has a band that wraps around that holds it tight to the body. That worked out real well. Now I'm sleeping in bed again instead of the chair. I use this, and then I still use this wrapper on the outside so that the arm stays immobilized at night. So if I move around, I don't take a chance on going over my head or bending it or twisting it. So just a little. The nice thing with this one being two pieces is I could just use this piece with my other sling, and it's a lot easier to stage. One more week, I'll be out of the sling, hopefully, so we'll go from there. Let's see, a couple other things. Pillows. Have plenty of pillows and covers and sheets and things like that wherever you're going to be at. Whether it be the chair, chair in the family room or the chair in the bedroom that you're going to sleep in, you have that stuff all within hand's reach so you can reach with your good arm. Let's see, know what to expect pain-wise. Some questions I wish I would have asked the doctor ahead of time. And he's like, oh, he's going to be immobilized and blah, blah, blah. Well, my questions now going back would be, what is a normal acceptable pain versus what's something to be concerned about? And also, what happens if I do move it and I feel some discomfort? What level of discomfort is normal? Because I've had a couple times I woke up in the middle of the night, I don't know if I moved my arm and if it was just hurting because it was hurting or hurting because I hurt it or injured it, which I didn't. But it's one of those things I wish I would have known what to be concerned about and what not to. Because not knowing, you think everything is, everything's in play. But I know this video is getting a little bit long here. I'm pushing 10 minutes. I want to go ahead and stop right here. If you have any questions, if you find this helpful, if you wouldn't mind throwing a thumbs up, or if you're interested in following as I do these updates periodically, go ahead and subscribe. I really appreciate that. But if you get any benefit out of this, if you wouldn't mind either throwing a comment or throwing a thumbs up so I know that it's helpful. Or if you have any questions, please leave those as well, and I'll go ahead and make sure I get those addressed both in comments or in future video as well. So I know I've had a few questions so far about all this, and hopefully this is helpful. I know there's some other videos that have helped me. So That's all I got for today. I thank you very much. If you have any questions, like I said, leave them below, and have a great day. We'll see you in a few weeks.